So our partnership came together because we all met in a group that's hosted at Chico State called North State Roots. And together it's a collaboration of professors, of community organizers, community collaborators who come together to talk about issues in our region. And so the three of us, Patrick Newell, Heidi Mendenhall, and myself, came together and saw a need in rural communities in our region to write a grant and get some resources into our community to talk about healthcare access.
This is one of those like true grassroots things, you know, because of my connection to Expect More Tehama, I got connected with Ann Schulte, who works at Chico State, and we were able to connect via Roots to these two amazing people, Amy and Patrick, who just are so passionate about rural communities and rural health and rural advocacy.
And we're putting together a program to help educate people about healthcare in rural environments and rural communities.
And when we were looking at the counties for when writing this grant, we see that there's just documented health deserts for medical care, mental health care, dental care, and nursing care.
We just don't have the same access to key resources all the time. And you know, I choose to live in rural California because we have amazing strengths, but it doesn't mean we have all the same medical information access. And I want to be able to support all of our young families, our young educators, our young home visitors, our young providers that do the boots on the ground work with families to have evidence-based information.
So we're here doing a training with the National Library of Medicine, whom we have a grant with, to be able to talk about these issues and get people access to healthcare information that they desperately need. So we're really excited about this collaboration, and we're excited to do more work together.
The entire collaboration here was an opportunity to bring together a research component, Amy, who's looking at how this sort of interaction with the community helps improve the community. Heidi and First Five and the educators, the promotoras, who are actually feet on the ground and know the issues of getting health information to people, but are also dealing firsthand with people who have needs and need important resources or information. And you need someone you trust, and that's what the promotoras and outreach are doing. They're someone trusted, and they're now developing skills that are backed up with resources from the National Library of Medicine and all of the professional health organizations like the National Kidney Organization to provide clinical information, healthcare information, directly to the end consumers.
One of the things that we know rural communities have is social capital. They work very well together and leverage their resources in really meaningful ways to make social change for their communities. And this is something that metropolitan communities can learn from rural people. So I hope through the research that I do and the research that I'm doing with this team, we can elevate rural people and elevate rural expertise as well.
It is not just about healthcare information, it is about whole child, whole family nutrition, physical activity, social connections, mental health. And we know these are the things that matter. We know these are the things that create the buffers in our lives that enable us to be resilient and thrive. And so I can't wait to tell the story. I can't wait to learn more. I can't wait to learn from families and providers. And it's just an incredible opportunity to be part of the team. It's been really amazing to see the growth and just kind of very organic journey that this project has taken. After the in-person training, we had 3 focus groups. They were incredibly well attended, incredibly diverse. We had bicultural, bilingual staff. We had folks who work across the region. We had folks that work with just one program in Tehama County, and we had folks that work across the county. So lots of different viewpoints. We had some folks early on in their career and some folks that have worked in the county for 20 plus years.
The data that we've collected, both from the focus groups that occurred after the training, as well as the survey data that we've collected, has given us a good indication that there's a real need for this information. There's a need for technology to help people get this information. And that by providing a tablet, we're actually allowing people to do the final mile and connect directly with families that need this information.
And we really saw some themes. We saw themes that this tool was providing a really accessible way without a whole lot of information for families to get some quick answers. We also learned that the people in the focus groups themselves were using it for their own purposes, which is really wonderful because whenever you love something, then you're better able to share it. And then we heard the common theme and barrier that really led us into this work, and that this was a great tool because they didn't have access to other healthcare providers. And so, this wasn't new information to us, but it's always incredibly rich to understand from a real context what it is.
Also found out that the tablet's becoming useful in getting people registered for benefits, enrolled in different programs that will help them, and generally connecting them up into systems that are helping them join communities and improve their health.
So the mileage of creating equal access for folks in the county through these health navigators is really going to reach farther than we ever expected it to. And I am just so really excited to see where the partnership grows and what it looks like for Chico State to focus on rural needs and our rural students and our rural career paths and how we can grow those partnerships.